let's begin. This is tea time. It's April 9th, and we're going to begin by, I'm going to show you some important slides. Here we go. So how do you treat patients with medical problems caused by toxins? The first thing is detect the cause. Let me explain that to you. If it's heavy metals, why? If it's mycotoxins and molds and toxic molds, where is it? Detect the cause. And once you detect the cause, then you have to remove the cause. And then third, you repair the damage. Let's go through that. So the basic principles is base your diagnostic testing and treatment, not on the opinions in the internet, blogs, Dr. Google, Dr. Facebook, unvalidated testing, unproven treatments, but do it on medical and scientific evidence. What does that mean? What is medical and scientific evidence? It's evidence-based medicine is the best scientific and medical evidence combined with the doctor's clinical expertise, not his experience. So let's begin. Here's what somebody said. I've watched all your videos and I very much want to use your treatment paradigm. I was formerly seeing a functional medicine doctor who was trained by Dr. Neil Nathan, but I've not made progress on this protocol for the last 3 years. Folks, you can do it in 6 months. And of course, because 3 years of all kinds of unvalidated tests and all kinds of experimental treatments, I have limited funds, so I cannot afford to start treatment with a new functional medicine doctor. But I can help you with that. The big medical secret, right diagnosis and the right treatment, the patient is well, gets well. The wrong diagnosis and or the wrong treatment, the patient stays sick for months and years and becomes more and more sensitive. Why do some of these patients become very sensitive? Well, here, supplements. They take 20 supplements every day, 30 supplements, 40 supplements, 50 supplements. And a recent study found, and it's at the bottom, so you can look it up, 11% of nearly 60 tested dietary supplements actually contain an accurate amount of the key ingredients that's on the label. So 11% are accurate. 40% did not contain a detectable amount of ingredients at all. So when you're taking that many supplements, 40% is you're taking things that are not on the label. Then here's this study, and it's again the American Journal of Public Health. An analysis of 40 dietary supplements for the presence of lead, arsenic, mercury, cadmium, or pesticide found trace amounts of one or more of these contaminants in 93% of the supplements. 93%, almost all had lead or arsenic or mercury or cadmium or pesticides, and this is not only one, but one or more. And one study for botanical supplements, meaning herbal supplements, contained plant species not listed on the label. On top of that, additionally, active ingredient substitution was observed in 83%. So although it may have said oregano, it wasn't oregano. So there you go. People take prescription fluconazole. It has a limited spectrum of activity. For example, it is not active against Aspergillus and several species of non-albicans candida. So whether it's Candida or the Aspergillus penicillium stachybotrys toxins, it's not effective. What is itraconazole? So there's two types of mold, single cell and multiple cell. Single cells are yeasts like Candida, brewer's yeast, baker's yeast. And sometimes the effective treatment is fluconazole for a few of these. But it does not, fluconazole does not affect multiple cell molds like Aspergillus stachybotrys penicillium. Itraconazole affects both single cell Candida and multiple cell molds. So obviously, what is the best one to take? So let me go back to this because some people say, oh, I read in Dr. Facebook that it's going to do this and that and the other. Okay, you really believe that? That's Dr. Facebook. That's not medical and scientific evidence. What are frequent misdiagnoses for mycotoxins and toxicmolds? Fibromyalgia and chronic fatigue syndrome, chronic Lyme disease, when it's really not Lyme at all, it's mycotoxins. How about depression? And then you take antidepressants and they don't work. Anxiety disorders, autoimmune diseases, POTS, dysautonomia, demyelinating diseases, and you're taking medication for that, but that's only treating the symptoms. It is not treating the cause. Here's a new homes and mold. Morning, doctor. I wanted to give you a heads up that you'll probably want me to postpone getting my blood drawn. I've started having symptoms again within the last 2-3 weeks, and we just found out we have mold in our brand new house. We just moved in during Thanksgiving. One of the drywallers accidentally punctured one of our pipes in a brand new home. Let's take a look at autism. This is an actual case. These are two boys, twins, 5 years old. Parents have gone to lots of doctors, pediatricians, pediatric neurologists, naturopaths, functional doctors. They've used various prescription medications, and they are listed here: risperidone, aripiprazole, sertraline, citalopram. Have tried various behavioral therapists and different diets. Nothing has helped much, including binders. There was mold in the home. How did these two boys, what was wrong with them? They couldn't sleep well. They slept 2-3 hours at a time. Occasionally they were aggressive, biting, scratching people. Of course, repetitive movements, etc. Very poor verbal skills. Mainly, they made noises with their voice. They played alone and had no sense of danger, and they avoided all kinds of physical contact. Well, this is their test results for mycotoxins before they got treatment. You can see how positive they all are. And after 7 months of treatment, you can see that it was much better. And here they are on the left picture, much better, smiling. And there I am with them. Many years later on, they wanted to see me again because now these two twin brothers, and I wore the same color shirt. Well, they were now studying at the University Industrial Engineering. There you go. This is a 20-year-old female. Is a young girl. She started feeling bad 8 months ago before she moved into an apartment while attending college. The parents suspected mold was in the college dorm, and this is why they moved her to the apartment, and now they're worried about it in the apartment they moved her to. The face and upper and lower arms developed a rash. She saw a dermatologist who gave her cortisone creams, helped a little, but not much, and kept getting worse. She has brain fog, fatigue, trouble with her classes and her homework. And here I'm going to show you what it looked like. The left picture is when she was sick, and the right picture is after I treated her. The left picture shows you how bad it was on her upper arm and her hand, her lower arm, and on the right side is when she was well. This is what she looked like before treatment, very highly positive. And this is what she eventually had to move. She had the apartment inspected for mold. So what are the steps you take? Check for mold. Wash all the clothes, towel sheets with vinegar and your usual detergent soaps for 3 times and once with ammonia. Throw out old pillows and get new ones, then and only then start treatment. Hydrocortisone and the supplements from detoxpure.com and follow the nutritional component. What happened? The skin started clearing up after 6 weeks. At 3 months, it was almost gone. At the first 2 months after that, she started feeling better. She had a bit of a problem following a nutritional plan because, of course, she was young. Young people like to eat pizza and burgers and things like that. At 4 months, the brain fog went away. She was less fatigued and felt brighter. At 6 months, she was back to normal again. And this was her study at 6 months. Here's the comparison. This is before and after. You can see the dramatic changes. Here's a 40-year-old female with breast implants. She felt fatigue. She was easily exhausted. She had short-term memory loss, trouble focusing, poor sleep, GI problems. Her gut was in a mess, muscle and joint aches and pains, and of course she had rashes. She'd seen many doctors, neurologists, functional medicine, naturopaths over the last 4 years, had many different tests, many different types of treatments, including binders, no improvement, and lots of money spent. This was her tests. You can see all the red, how red it is. Well, she started treatment. And this is what I gave her. Sporanox, 100 milligrams twice a day with food, 8 specific supplements and vitamins at precise doses from detoxpure.com. And her nutritional diet consisted of an anti-inflammatory, low histamine diet. What happened? This is what happened. Can you see how much better she turned out to be? And this was her implant. The left one is a normal one. The right one was her implant. What do you think is in there? It's mold. What about this article? Biomonitoring of mycotoxins in plasma of patients with Alzheimer and Parkinson's. So we go to the other end of the spectrum. This is the plasma level of these patients. There are 44 Parkinson's disease and 24 Alzheimer. And then they also compared them to healthy companions who are, and their blood test. What did they find? These 3 mycotoxins in the blood, not the urine. Remember that, it's in the blood. It's not what is left the body, it's what's in the body that matters. So here is this study that showed evidence that glutathione is associated with causing Parkinson's disease. Glutathione causes Parkinson's disease. Well, look at this. This study on gliotox, 3 different studies are mentioned here. They're all referenced here at the bottom. They're all from peer-reviewed medical journals. This study demonstrated the mycotoxin gliotoxin causes demyelination leading to multiple sclerosis. This was done at Rutgers Medical School in New Jersey, published in 2010. It stated, we propose here that fungal toxins are the underlying cause of multiple sclerosis and thus may offer an avenue towards an effective cure. And ladies and gentlemen, I've seen many, many patients over the last 30 some odd years with MS, multiple sclerosis, and a year later, they come in wheelchairs, and a year later, they're playing tennis. So gliotoxin has been shown to affect and damage these are cells from the brain, microglia, astrocytes, and oligodendrocytes. Gliotoxin is a mycotoxin that's a neurotoxin, affects the brain. Don't use glutathione. Binders. Okay, they're supposed to work. They're all over Dr. Google, they're all over Dr. Facebook, etc. What do the studies, the medical evidence shows that such absorbents are highly capable of neutralizing aflatoxin only. But aflatoxin is not found indoors. It's only an outdoor mold, mycotoxin. However, this is what it's the important part for you to listen to. They are relatively ineffective in cases of other mycotoxins. And in addition, they also bind vital vitamins as well as macro and micro elements. What are those elements? Magnesium, zinc, etc. And here's another study about binders. Some physical strategies, such as application of absorption agents, such as binders, presented no sufficient effect against mycotoxins. So what's the best and most precise and accurate test? It is the blood test, the serum blood test for both IgG, which indicates a toxic reaction, and IgE antibodies, which is mast cell activation for 14 different mycotoxins. What else? So here's a study that was published 3 years ago, not quite, 2.5 years ago. So the ELISA method to detect mycotoxins in human blood serum comes with significant accuracy, precision, and specificity. You want the most accurate test of what is in your body, not what's left the body and urine. Here's a patient. I've watched most of Dr. Campbell's webinars on MyMycoLab's website 3 times each. I'm a health coach, and I was working for a US group that had a shoemaker mold protocol, which was useless. I stopped health coaching at that program and focused on mold remediation people's homes, as I think so many of my sick clients had molds in their homes without realizing it. Here's from a doctor, Dr. Campbell. I am simply blown away with your knowledge base. After hearing you at A4M, this was a medical conference last December 2024, I gave at the American Academy of Anti-Aging Medicine, A4M. I dove into your videos and I wish I had met you years ago after getting sucked into the shoemaker Nathan vortex. At least going forward with your direction, I will be able to truly help my complicated patients. And folks, here's these 6 studies, 1, 2, 3, 4, 5, 6. I'm sorry, 5. 1, 2, 3, 4, 5. I've published over 100 studies. I teach at 2 medical schools to faculty, not to medical students. I have the credentials. Ask yourselves, when somebody says to you something, how many studies have you published? in medical journals? And they will say to you, probably none. So that on top is my address, email address. So please email me with any questions you may have. So here's these questions coming up now. Can you develop fungal resistance if itraconazole is not taken consistently? No. Have you had any patients whose hippocampus shrank because of mold and the protocol became better? Let me ask you something. Ask the people who put this on there if they would also provide you with the medical evidence from a medical journal published article about that, and they will not be able to do so, okay? So here's one, IgG and IgE. I just got my results and I'm pretty high on all 14 mycotoxins for IgG and only on the level 2 for about 4 of the mycotoxins and IgE. My functional doctor says this leads them to believe I'm not actively in a bad mold situation. That is wrong. It could be just of previous exposure. Well, your doctors don't understand molds and mycotoxins. For patients with CIDP, let me explain what that is. Chronic inflammatory demyelinating polyneuropathy. What percentage have you seen that are able to fully be taken off IVIG? IVIG is intravenous gamma globulin. How do you recommend tapering off? Well, I've seen almost 18,000, and I've successfully treated almost 18,000 patients. Many, many, many of them with CIDP. After they go through the treatment, they no longer need CIDP. This is a very interesting question. Could mold toxicity cause a low NK cell count? Yes. I've published with my colleagues studies on that. Then I get this question. This is are the supplements you recommend one size fits all, or should they be tailored to the patient's health history and lab results? In general, it depends. Everything depends on each patient. I've been on itraconazole for 2 weeks. I've always been prone to cankers, but since starting antifungals, the cancer out of control, really bad and painful. Any advice? Yes. The 4 steps are, number 1, make sure there's no more mold in your environment before you start treatment. Number 2, itraconazole. Number 3, the supplements. And number 4, the anti-inflammatory low histamine nutritional diet. It's a 4-legged table. You leave any of them off, it won't work. You treat remotely. I've taken your mycotoxins. Hang on here. Do email you to start treatment. The only patients I see are the patients that are sitting or standing in front of me. I don't do things remotely. Do you see patients in persons? That's the only way I do it. Have you ever heard or seen mold exposure coming through well water? Trying to cover all bases with testing. I would certainly test it and check it. T2 toxin is very high for me, and I believe causing colitis, major intestinal bleeding, trying to find the source. Well, it's not part of this particular tea time, but I've done many others, and they're all on MyMycoLab's YouTube channel. And yes, mycotoxins are known to cause what are called inflammatory bowel disease. This is SIBO, irritable bowel syndrome, Crohn's disease, ulcerative colitis, etc. So yes, these do that. Can mycotoxins cause vestibular migraine and persistent postural perception dizziness? Yes, published a study on that back in the 1990s, 30 years ago. If so, will itraconazole and your recommended supplements treat those conditions? Or should I be treating the migraine and the PPD with migraine meds? If you treat them with the meds, it's just treating the symptoms. Remember the first slide. Identify the cause, remove the cause, repair the damage. So if you follow the treatment method, all these things will go away. Does itraconazole disrupt biofilms? Yes. Any recommendations for taking oxide supplements that don't contain maltodextrin and modified food starch like N101? Nitric oxide is only used in certain cases. So it's not used in some cases, and in some cases used. It's not everybody do this. For those patients with mast cell activation syndrome, taking Xolair to reduce mast cells, can they come off Xolair eventually? Yes. How do you schedule an appointment with me? You have the email address in front of you on the screen. Can you help with electromagnetic hypersensitivity? Yes, there have been several studies published on what are known as EMF, electromagnetic field hypersensitivity, due to mycotoxins and toxic molds. So yes, that all goes away with the treatment. My recent blood work revealed ovalocytes and stomatocytes blood cells. Could this be due to mold exposure? I couldn't find any literature on the matter. Where did you look for the literature? If it was in Facebook or Dr. Google, you won't. You need to find it in the National Library of Medicine, known as pubmed.gov. Okay, if the mold exposure was 20 plus years ago, can someone still fully recover from treatment? Absolutely. Does estrogen or progesterone fluctuations affect ADH or aldosterone production if exposed to mycotoxins, especially if you're positive for zearalenone? Zearalenone is a highly estrogenic mycotoxin. It'll throw progesterone and estrogen completely out of balance and your hormones. If we can't see you in person, what type of doctor do you recommend we see? I have several, depending on where and what part of the world you live in. If you have a positive mycotoxin result for antibodies with some low to mid-level, does that inevitably mean you will have symptoms? If we tested several people with zero symptoms, when any of them, I've never seen a single patient in almost 40 years of being a doctor that came to me and say, I have no symptoms, test me. Do mycotoxins cause bone pain? I have a study right here that I just received today. And that study is on how it causes bone abnormalities and bone pain. So yes. Does mycotoxin exposure cause leg cramps, weakness feeling in the legs? It can. My doctor said high IgG for 3 mycotoxin was due to past exposure, not current exposure. He doesn't understand mycotoxins. Mycotoxins are not pathogens like viruses or bacteria. They're molecules. He does not understand that part of medicine. Oh, you looked it up in PubMed. Very good. Email me and I'll help you. Are you willing to consult with a neurologist that isn't convinced CIDP can be caused by mold? Willingly. Do you know how many studies are out there on how mycotoxins cause CIDP? I don't think your neurologist is reading these studies. I'm treating a 5-year-old child with ASD since January 25. She normally developed till 2 years old. The family was living in a moldy house. At 2, she began regressing in speech, then developed eczema, gradually violent behavior. After starting itraconazole, along with multivitamins, magnesium megaspore, sulforapane, and gut support, her sleep improved, less skin reaction. She was able to attend daycare 4 hours a day. Now she is worse again, very aggressive. Again, if you add things, you don't know if these things are actually say what they say on the bottle or in the bottle. Besides potential new exposure, she is in Slovenia currently and doesn't know how prevalent the mold issue is there. Well, that's the second problem, which is probably more important. Can you refer me to a doctor in Boston whose specialization mycotoxins? I can. Do mycotoxins cause high kidney filtration rate, low BUN, and creatinine? They're well known to affect the kidneys, and that's been a fact for like 40 or 50 years. Did you test asymptomatic patients? Yes, the lab tested 160 healthy donors. My wife just started on itraconazole. She's having heavy vaginal discharge. Thoughts on why? Without having much more information, I don't know. So I'd have to know more of her medical history. Do mycotoxins cause salt loss in the urine? Well, because mycotoxins are molecules that can affect the kidneys, that's anything is possible with the kidneys. So here's another question. If there are no eosinophils found when they did my FESS, could it still be a fungal infection? They called it AFS, found Alternaria penicillium in their culture, put me back on Enbrel. Things got worse. Your lab test showed IgG to Alternaria penicillium 4 years ago. After the FS, I just found out my office has high levels of Stachybotrys in the ductwork. Well, after 4 years, I'd certainly repeat the test first. So IgG and IgE do not mean past present exposure. You can be in mold and only have high IgE. No, you don't understand it. IgG indicates currently what's in your body, not your environment, not in the bedroom, the bathroom, the basement, what's in your body. High IgE indicates current exposure. Can mycotoxins cause DNA changes? It causes DNA, RNA changes. Do mycotoxins cause eosinophilic esophagitis? Yes, they can. Any other questions, folks? How many sprays of amphotericin B do I recommend? It's not I who recommend it. It's the studies that have looked at this very carefully. And they say 2 squirts of amphotericin B at a 0.03% solution in each nostril twice daily. What's the best diet to help with mold detox? An anti-inflammatory, low histamine diet. Let me see. Okay. Can a patient be fully recover after exposure was 20 years ago? Yes. How many people have to use amphotericin B with Sporanox? Those who have chronic sinusitis. Should I be concerned about my liver with mold? Not really. It can affect the liver, but in general, I have not seen it affect. Studies do not show this. It's not what I see. What's important is what medical evidence shows. Could you briefly explain the difference between IgG and IgE? I just did. I'll explain it one more time for you if you weren't listening a minute ago. And that is IgG indicates that currently in your body, those are the mycotoxins inside your body causing a toxic reaction. IgE antibodies indicate mast cell activation and current exposure. Does amphotericin B need a prescription? Yes, it does. Are all cases of autism caused by mycotoxins? No. Question from group. Was there any asymptomatic tested along with symptomatic? Yes, 160. I think I answered you whole life just a minute ago. It's 160. How seriously does ochratoxin A affect the kidneys? It doesn't. There are studies that are shown, and if you watch some of my other videos, that ochratoxin is bound to human albumin, the number one protein in the human body, with 99.8% binding. So it does not go through the kidneys. I'm currently living in a mold situation and have IgEs. Should the IgEs also be elevated? It depends. Every person's immune system is unique and different. Had colon cancer mass in my liver removed. I don't understand how colon cancer could be in the liver. By the way, in a study on 17,401 patients with 35 different types of cancer, mycotoxins were found in all 17,401. Can you specify diet details? Not in this short time. What foods that you have to avoid that someone might be initially suspect of being a problem? Basically, you have to avoid what has colorants, artificial colorings, artificial preservatives, artificial flavorings, all those kind of things. Also, gluten-free, dairy-free, and soy-free. Lou, I answered that question a few minutes ago. If I can't find a doctor in Oregon willing to treat my CIDP, can you help? Well, what is causing your CIDP? I need to know a lot more than just I have CIDP. My mycotoxins test results list only 14 times. Does that mean you only test for 14, or that I personally have only 14%? No, those are 14 that you have, and those are the ones that cause problems in humans. How does mycotoxins affect ringing in the ears and flutter in the eyes? Published studies, and again, this is from 30 years ago, so this is well known, okay? How does studies showing how mycotoxins affect the acoustic nerve and how it causes optic neuritis, all these affecting the hearing and vision. I'm the only person known who has this confirmed. I'm not sure what you're saying, that there was a colon cancer in your liver. I'm not sure I understand that. I was given sublingual immunotherapy for molds. Could this have made me worse? I don't know. Usually that is for molds. These are mycotoxins we're discussing. Where to go for supplements to support detox? I'm going to answer this. I'm going to end the chat. It's called detoxpure.com. I gave it in the talk, in the lecture. My myco test showed relatively low IgG, very high IgE. After 5 months of treatment, you need to wait 6 months to be tested. My second MyMycoLab showed relatively high IgG, but relatively low IgE. I could not understand how this occurred. There's a lot of explanations. What is your treatment? Are there molds in your current place? Were there molds in your previous place? Did you move somewhere? Did you have any remediation done? Many, many other questions. You can't just answer it off of this, Bill. Folks, any more questions? I was tested 7 months ago, and I'm positive for all 14 mycotoxins. Will you suggest being tested again prior to starting on itraconazole? No. I would start the treatment, and at 6 months, folks, 6 months, you repeat the test. Can high levels of mycophenolic acid, and if you have high levels of penicillium toxin in your home, can it cause low immune response to things? It depends on your immune status, how old you are, what are your other diseases, are you sick with other, do you have diabetes, do you have high blood pressure, all kinds of things like that. You're welcome to write to me and I'll in my email. Why is it that after 8 weeks we're supposed to feel better? Because it takes 8 weeks for the medication to work. Let me ask you something. Say you have bronchopneumonia, pneumonia in your lungs and bronchitis. You think the first day you take an antibiotic, you feel better, or does it take several days? Same thing here. Can you recommend any doctors in Oregon? I cannot. I don't know I know doctors that treat, but I don't know what specifically they may treat. Could degenerative disc disease, spine bulging disc, be an inflammatory disorder? Well, we know that mycotoxins cause inflammation. Now, whether they cause that depends on each patient. What die-off Herxheimer side effects should we expect once we start treatment? In my patients, about 3% have Herxheimer, and what I tell them is keep taking the treatment. After a few days or up to a week, it'll go away. Are they a way to take IV supplements for treatment if I can't tolerate hardly any supplements, foods? I have a lot of trouble eating due to severe abdominal pain, sensitive to almost everything. I discussed this previously, why, and so I would recommend that you contact me or get a hold of your doctor and ask him. How long does someone need to be off Ocrevus for MS to get an accurate mycotoxin antibody test? 8 weeks. I need a mold competent MD in Minnesota. Do you know of any? I do. Do mycotoxins cause heart racing going more for an hour without drinking water or eating salt? Yes. Is it okay to take ivermectin for mycotoxins? For parasites, where did you get the parasites from? Unless you eat raw foods and not raw vegetables and not raw fruits, but raw meats, raw pork, raw beef, raw fish, then you would have parasites. I purchased the Triad ale filter and emits ozone and UV light to kill mold spores and mycotoxins. Do you think it's a good thing? Mold spores are your hair is 100 microns thick. Mold spores are 2 to 4 microns thick, and mycotoxins are 0.1 microns thick, the same size as a COVID virus. Did they have Triad air filters all over the planet during the pandemic to stop something that small? No. Can we split the itraconazole, gradually work up? You can do it any way you like. It depends on your doctor. You mentioned early that 17,401 patients in a study had mycotoxins in their, no, they had it in the tissue of the cancer. Do you know if mycotoxins were equally impacting each of those patients? I would recommend you read the study, and it's available freely to the public on PubMed.com. Any other questions? In the previous webinar, you said don't take glutathione if you have positive score on gliotoxin. Should we also not take NAC? Okay. Yes, not NAD. NAC or NAD. I don't know what NAD, but NAC, yes, you should not take it. Okay, on my bottle of amphotericin B, it says 1 pump 2 times a day. I said 2 pumps, yes. Thank you for your time and helping so many people. God bless you. Thank you so much, Ms. Sharon. I appreciate that. If a patient starts itraconazole or voriconazole while still in the environment, it won't work. You have to be out of the environment. That's the first rule of toxicology. How helpful will hyperbaric oxygen therapy be for mycotoxin inflammation? I have a good friend, an old friend, Dr. Paul Harsh. Dr. Paul Harsh wrote a book, The Oxygen Revolution. He is an expert in HBOT, and it does not work for mycotoxins. I just saw him a year ago at a conference, and we discussed this. He and I agreed that it does not help, and he has tried it himself, and it does not work. Is infrared sauna helpful? Yes. How do you feel about Dow? Show me the evidence that it does anything. In my opinion, there's none. I mean, remember, folks, I've published over 100 studies. I'm also the editor-in-chief for 5 peer-reviewed medical journals, so I read a lot. And I read what's medical evidence, I don't read all the other things on the internet. If starting in the environment, will they get worse or not just fully recover? It won't work, period. Should we introduce all your supplements at once? Yes. What are the recommended detox protocols along with the azole and supplement treatments? There's only two more. One, don't be in any contaminated environment with toxic molds. And number 2, as I mentioned a couple of times before tonight, in this video, be on a low histamine anti-inflammatory nutritional diet. Why is soy bad? All soy in the United States is sprayed and treated with glyphosate. That's why. IgG and IgE results are high. Why am I gaining weight when I'm eating according to low histamine diet and anti-inflammatory diet? Well, it's not only the diet, it's all the rest as well. And it takes several months of treatment. It's not going to go away after, a couple of weeks or a month. Roger, I appreciate your comment. Thank you very much. Thank you, Sharon. Why is dairy bad? Because it has the potential pro-inflammatory proteins. If I'm actively treating mycotoxins, does it seem safe to go on a vacation to an Airbnb for a week? I'm worried about being in a house. Yes, I'm with you on that because I don't know if you all know this, but I lecture at medical conferences. I'm invited to give presentations like this one every 2 weeks. So figure out 52 weeks in a year, every 2 weeks. I'm every 20, about 20 times a year, I'm at a hotel somewhere. So you never know. And I don't know. Can extreme stress bring about symptoms if still recovering? Of course. Bad diarrhea is bad. Could mold cause calcification in the arteries? No. If a patient with CIDP is currently on IVIG, you slowly taper off during the antifungal treatment. Depends on test results. What are the diagnostics for your CIDP? What tests did you have, etc.? I have very high IgG DON toxin, that's deoxynivalenol, and aspergillus penicillium, but very low on IgE while I was still in the home. You shouldn't, let me ask you something. How much mercury is okay to have in the body? None. It's the same with mycotoxins. All toxins should be at 0. I'm very paranoid about staying anywhere, especially a hotel, hoping sensitivity to improve with treatment. Thank you so much for all your information. You're very welcome. IG is so high, I can't start itraconazole because exposure site at school, so I can't do anything about that. Is there another treatment available? Unfortunately, no. Thank you, Dr. Campbell. I tell everyone about you. God bless you. Your protocol saved me after a year of expensive, useless detox. Thank you so much. Very kind of you, Miss Tracy. Husband and I got betrayed by a group of people and are grieving. He got a rash, flare up, and I got hit with some fatigue. Is this normal? Still recovering from that stress? It could be. Thoughts on voriconazole? I reserve voriconazole only for very, very highly severe cases. Once you clear of mycotoxins, are you more susceptible in developing again? No. It's like mercury. Once you get rid of the mercury, are you more susceptible? No. Folks, we're reaching the end. I'm in 4th month of your protocol. It's a slow process, but I do feel it is working. I can't wait to retest at 6 months. Well, I can't either, honestly speaking. I know it works, and there's been almost 18,000 patients that it's worked for. Thank you, Dr. Campbell. I'm looking forward to seeing the results. I just started itraconazole and ordering the supplements now. I would recommend you get them from detoxpure.com. Do you think most IBD cases reverse with treatment if caused by mycotoxins? They do. That's well known. It's been well established in medicine. Is there something irreparable damage done? No. Thank you for your wisdom and help. God bless. Thank you, Miss Stacy. Thank you very much. Very kind words. Thank you. Thank you so much for all your help. I've had CIDP for over 2 years and finally have some hope that this isn't a life sentence. Just to let you know, person from Oregon, I have treated many, many patients with CIDP. I wrote a book on it in 2021. I'm sorry, 2001, 23 years, 4 years ago, on how to use it, how to treat it, etc. So no, I can tell you clearly, it's not a life sentence. And in my center, we had a neurologist. He had a PhD and an MD in neurology. And he agreed. And we published studies on that. Some of them, one of them is actually a chapter in a medical textbook on CIDP. Do some patients need to take itraconazole for longer than 6 months? A few. Depends on how long you're exposed. How's your health? Did you eat Pringles and Coke in front of the TV every night for years and years, etc.? Roger says, check your environment. I thought I was in the clear and my office at work was a huge problem. Yes, sir, it sure can be. FYI, it's the group. All right, folks, I think we're ending our time here. Thank you for joining. Thank you for your questions. Always feel free to email me. You see my email there. I always do my best to help everyone, as I have for many years. And I wish you all the best and good health. Bless you all. Have a good rest of your day.